Hello and good afternoon. I am Pamela Chapman, Chair of the Mental Health Awareness Month Subcommittee. Welcome to our presentation, Care for the Caregiver. The speaker for the evening is India Johns, and she is a board-certified clinical social worker specializing in trauma and perinatal mental health. She holds a doctoral degree in public health and a master's degree in social work, and she has worked within the field of behavioral health for over 15 years in medical and mental health hospitals, group homes, communities, and outpatient mental health clinics. Some of her previous work experience includes providing advocacy, psychotherapy, treatment planning, psychosocial assessment, consultations, and perinatal psychiatry rotation curriculum development. Please join me in welcoming Dr. India Johns.
Thank you. So we can get started. So thank you again, Sora. Hello, everyone, and thank you all for joining today's webinar on empowering caregivers supporting loved ones with mental health conditions. As stated, my name is India Johns, and I'm happy to be here with you today. Next slide. As a disclaimer, this webinar is not intended to diagnose or provide clinical intervention. There are resources listed at the end for linkage to interventions. Next slide, thank you. Today's webinar will provide an overview of mental health, caregiver roles, caregiver challenges and benefits, caregiver acknowledgement, tips for caregivers, mindfulness, self-care, and resources. Next slide. As the month of May just passed, I'd like to acknowledge that May was Mental Health Awareness Month, and May 21st was World Meditation Day. I've incorporated a 3-minute self-care meditation into today's webinar, and hopefully everyone will be able to hear it. If not, I've included the website as well. Next slide. So how common are mental health conditions among youth and adults? Over 1 in 5 youth ages 13 to 18 have had a serious, debilitating mental health condition at some point. More than 1 in 5 US adults live with a mental health condition. About 1 in 25 US adults live with a serious mental health condition. Mental health includes our emotional, psychological, and social well-being. It affects thinking, feelings, and actions. It also influences stress management, relationships, and decision-making. Mental health has significance throughout the lifespan as it impacts thinking, mood, behavior throughout our entire life. Next slide. Mental health conditions are the mental health disorders affecting thinking, mood, and behavior, which range from mild to severe. Some causes of mental health conditions include biological, such as genetics, experiential, including trauma and abuse, familial, by having a family history of mental health conditions. Next slide. Mental health in youth. The most frequently diagnosed mental health conditions in children are ADHD or attention deficit hyperactivity disorder, behavioral problems, anxiety, and depression, with only about 50% of youth with mental health conditions receiving treatment within the past year. Next slide. Mental health in adults. The most frequently diagnosed mental health conditions in adults include schizophrenia, bipolar disorder, and major depressive disorder, with only about 20% of adults receiving mental health treatment in the past year. Next slide. Again, for the purpose of this webinar, we are referring to caregivers of loved ones with mental health conditions. The term caregiver can be defined in many ways. Can someone provide a definition of caregiver?
I would say that a caregiver could be a parent, a relative, and even some cases a teacher or counselor, social worker.
Absolutely. Thank you. So, anyone providing care and support to a loved one with a mental health condition, ensuring their physical, emotional, and social needs are met. So, that's one way we can define a caregiver. So, as stated, caregivers have many roles, and that can include being an emotional supporter who provides reassurance and meaningful conversations to reduce isolation and depression, an advocate who secures health services and represents their loved ones with mental health providers and all of their providers, medication management that ensures correct and timely medication intake, and daily life coordinator who assists with daily activities and routines and just ensuring that their loved one is organized throughout the day. Can anyone else identify any other roles that?
I would say, a mentor. A lot of times people might look up to their caregiver, as,
Mhm,
a role model or somebody that they, like, really depend on for, just life advice.
absolutely. Thank you. So next slide. So here are some additional caregiver roles. So being a cook, helping with school, attending appointments as stated, just being an active listener. Next slide. So in addition to being a caregiver to a loved one with a mental health condition, caregivers have other roles and responsibilities. So for instance, a caregiver can also be a parent who has other children. They can be caring for a parent or a sibling while having their own children as well as a spouse. They still would have to perform at work. And for some caregivers, they may be the only person that everyone depends on, which can be a huge burden. Next slide. So next we'll talk about some caregiver challenges and benefits. So some challenges include emotional strain, financial burden, time management, and lack of support. However, there are some benefits, which include emotional fulfillment, personal growth, strengthened relationships, and increased awareness. Next slide. So, with the multiple roles, difficulties, stressfulness, and everything else that comes with being a caregiver, I would like to take this time to acknowledge every caregiver and every caregiver supporter. Thank you. Next slide. So, next, we'll talk about some tips for caregivers. Prepare yourself, educate yourself on your loved one's mental health condition, identify their needs, identify your needs, and don't forget to take care of yourself. Your involvement matters. Be empathetic, provide encouragement, help your loved one set goals, create healthy boundaries, show compassion. Next, build a support system. And this includes providers, all of your loved one's providers, your providers as well, and surround yourself with supportive and empathetic family and friends. And make sure you know who you can call on based on the type of support that you need. Next slide. So these next two slides are handouts from the Substance Abuse and Mental Health Services Administration, or SAMHSA. So this handout here is titled Helping a Loved One Dealing with Mental Health and/or Substance Use Disorders. And it includes some of the tips that we just discussed. Next slide. This next handout is titled Supporting a Loved One Dealing with Mental Health and/or Substance Use Disorders. And it discusses starting the conversation with the loved one dealing with mental health and substance use disorders. Now we'll discuss caring for the caregiver. Next slide. This slide provides an example of warning signs of factors related to mental wellness, which can impact our well-being. So we have physical, such as fatigue, pain, or headache. Behavioral, such as decreased physical activity, changes in eating habits, or alcohol or substance use. Social and emotional, such as decreased social activity, neglecting household responsibilities, and occupational problems. And emotional and cognitive, such as depressed mood, irritability, difficulty concentrating, and negative self-talk. So in reviewing these warning signs, it's important to be in tune with our bodies and know our warning signs. The next topic we'll discuss is mindfulness. Is there anyone who would like to share a definition of mindfulness or what they think mindfulness is?
Good afternoon. I
Okay.
actually was going to say mindfulness really is, I guess, being cognizant of your surroundings, what's happening, what's going on, not only with yourself, but for the person that you are caring for as well.
Perfect. Okay, so mindfulness is a mental practice focused on being fully present and engaged in the current moment. Being aware of your thoughts, feelings, and surroundings without judgment. It involves paying attention in a thoughtful and non-reactive manner, helping to reduce stress and improve mental clarity. Some key components of mindfulness include attention regulation, focusing on the present moment and redirecting attention when your mind wanders. Acceptance, embracing thoughts and feelings as they are without trying to change or judge them. Body awareness, recognizing bodily sensations and their connections to stress and emotions. Emotion regulation, understanding and managing emotional responses for stability. Self-compassion, which is extremely important. Maintaining a kind, non-judgmental attitude towards oneself, especially during difficult times. Perspective taking, adopting a balanced, less reactive view of experiences to enhance resilience. Does anyone practice mindfulness?
I try.
Yeah, we try.
Yes, it's not always easy,
Right.
especially with having a busy life, so I understand. I try as well.
I
So,
personally don't think I purposely try to be mindful, but I do take a moment if I'm feeling stressed or if I'm going through something. I have to like just take a deep breath and just kind of center myself. So I guess it kind of is mindfulness.
absolutely. Anyone else? Well, thank you for sharing. So I enjoy taking mindfulness walks, especially on trails. I also love to look at the sky because it serves as a reminder that the world is so much bigger than me and anything that I may have going on. Go ahead.
I was just gonna say, also just sit back, relax, and meditate on gospel music for me.
Absolutely. It sounded like someone else was going to say something.
Yes, I was going to also add that taking a walk and then just sitting near water, because water is very healing and very calming. So that's one mindfulness practice that I do.
Perfect. So thank you everyone for sharing. Next slide. So some of the benefits of practicing mindfulness include improving mood, attention, and quality of life. We can practice mindfulness whenever we need to, and it aids in being present in the current moment. See, someone just added something in the chat. So coloring in calm swirls, adult books. So I enjoy coloring as well. I have a couple of coloring books. I have not used them in a while, but I like to just put some classical music on, and color really helps with calming me as well. So thank you for sharing. Okay, so an important component of mindfulness is awareness, which involves being tuned in to what's happening in the present moment. It includes acknowledging sight, sound, smell, and physical sensations. It is essential to recognize how your body responds to stress, such as rapid or shallow breathing, increased heart rate, sleep deprivation, irritability, headaches, or muscle tension. When you become aware of your body's response to stress, you can remind yourself to utilize a relaxation strategy and practice mindfulness. Having self-awareness helps with recognizing and understanding your own thoughts, emotions, and behaviors, identifying stressors, emotional triggers, and behavioral patterns. You can also have better management of responses to various situations, and it encourages the adoption of healthier coping mechanisms. Does anyone have anything they'd like to share about self-awareness? Okay.
My only thing to share is that I could do better.
I think we all can. Thank you.
I think that we all can do better. And I'm sorry, I'm having a terrible time always trying to get off mute and off of camera. So I do believe that we want to be self-aware. And there are times where we know we're self-aware. We are stressed. We know that there are things going on, especially if you are a caregiver and you are a caregiver of like your parent or your sibling, though you have a lot of those stressors that are there, and there's an emotional piece to it, as you spoke to earlier today. So I believe that caregivers, yeah, we're self-aware. We know that we're stressed out, and what is it, what is it that we can do? Sometimes, caregivers don't have the time to unfortunately relax or be even more self-aware, and that's, I think, where a lot of issues come in.
Absolutely.
And I also wanted to add in that, in addition to not having enough time, also not having enough resources or other family members or friends to pitch in to help, and just not knowledgeable about some of the things that are available, such as respite care, where there are organizations who can come inside the home, to give you like a few hours to like
Right.
step out and grab a coffee or just meet with a friend. So I think it's very important to find those resources and to tap into people who can help you so that you can maintain your self-awareness.
Absolutely. I agree 100% with both of you. So I do have some resources at the end of the presentation that includes respite care. And
Yeah.
within the presentation, we're also talking about support systems and finding your community, because that is one of the biggest issues with being a caregiver, not having that support.
We do have something in the chat from Sora Sheila Robinson stating, in my quest for self-awareness, I am learning to practice more self-compassion and self-care.
Wonderful. That is a perfect quest. And I hope that everyone takes that in. Okay, so we discussed practicing mindfulness, but here are some additional examples. And I can share something else that I try to practice for mindfulness, which I have not done in a while as well, and that's mindfulness journaling. And I remember when I did used to practice mindfulness journaling, it would help me with feeling a sense of relief. So, breathing techniques are a great way to regulate our bodies and focus our minds. So, here is an example of one breathing technique that we can practice, where you want to make sure that you sit or lie in a comfortable position with your back straight and your shoulders relaxed. Gently close your eyes to minimize distractions. Pay attention to your breathing. Notice the sensation of air entering and leaving your nostrils, or the rise and fall of your chest. Take slow, deep breaths through your nose. Hold for a moment, then slowly exhale through your mouth. Count your breaths to maintain focus. Count each inhale and exhale up to 10, and then you would start over. And if your mind wanders, you gently bring your attention back to your breath without judgment. And you can practice this for about 5 to 10 minutes or as long as you need. And I know, as we just discussed, it may seem like we don't have time for this as caregivers, but in the moment you may not recognize it, but it's important to be able to take time for yourself so that you can care for your loved one.
So if I'm honest and I'm practicing this particular breathing technique, it's going to lead to me falling asleep. Honestly, even if I'm sitting up straight, I'm closing my eyes and I'm breathing in. Next thing I know, I'm going to be knocked out, which is probably something that I need to do in anyway. So
Yes, that's self-care, taking a nap. There are plenty of other breathing techniques that you can try. There's box breathing, where you trace a square. So at least you're active while you're breathing. So that that may help.
They also have a lot of apps now that
Yes.
assist with breathing. And I tried to use one time at work, and like Sora Page Reeves said, oh my gosh, I thought I was about to fall asleep at my desk. I was like, oh no, I can't use this here. But they're very calming though, and they really work.
Yes. All right, so next we have a 3-minute self-care positive affirmation meditation.
Welcome to Aura. Hello. I'm Allie Rose, and today I'm looking forward to sharing some affirmations that you can use to increase your confidence and belief in yourself. I will achieve great success. I am capable of achieving any goal. I am ready to face anything in this life. I will remain positive. I am focused on my success. I can handle whatever challenges life throws my way. With each passing day, I feel more confident in my skills. With each passing day, I become more capable and powerful. I love myself. I believe in myself. I respect myself unconditionally. My self-belief is turning me into the highly successful person I am meant to be. The self-belief I have will help me grow. Success is a normal experience for me. Self-belief and self-confidence are my natural states. I pursue my goals with ease and confidence. I am a highly capable person. I can achieve anything and everything that I want.
Does anyone have any thoughts after listening to this meditation?
So I just had a question. How do you, I guess, do it? So were we supposed to say and recite everything they say, or is it just kind of like a sit and listen thing? Like how exactly do you utilize something like that?
So the way I do it, and this is the app that I have, I sit when I wake up in the morning, when I wake up at a good time, and I have extra time, I sit in the bed and I let the meditation play. I close my eyes and I clear my mind and I listen to what the person is saying and I receive it. But you can do it how that's for me, that's the best way to do it. But there's also other ways that we'll discuss further on in the presentation. You can have your own affirmations that you recite daily just to practice self-care and that positive self-talk. But for this meditation, this one just had positive affirmations. Other meditations, you'll hear them tell you to close your eyes and relax your body, just like we talked about with the breathing exercises to sit and lie in a comfortable place. Does anyone else have any thoughts?
Yes, Sora Robinson put some really good affirmations in the chat, and she wrote daily affirmation, may I be happy, may I be healthy, may I be safe, and may I be at peace. Those are great.
Yes, I love those.
Thank
Thank
you.
you. And I do want to mention that for the meditation, you can also find meditation videos on YouTube, and you can do a meditation for 1 minute to 3 minutes. It doesn't have to be a long period of time. Okay, so with this next slide, I'm sure that most of us have heard this saying, you cannot pour from an empty cup. This stresses the importance that caring for yourself is essential. You can't fully care for others if you're not taking care of yourself. Self-care is the ability to maintain physical, emotional, relational, and spiritual health in times of stress, and overall. Self-care involves intentional, healthy actions to preserve and improve our own well-being and happiness. So why is self-care important? It helps with decreasing stress, avoiding burnout, increasing productivity, as well as increasing happiness and inner peace. With self-care, it's also important to recognize that practicing self-care is not selfish and is essential to our well-being. When practicing self-care, you want to ensure that you're tailoring your practice to you as an individual and identifying what works for you, because what works for a friend or someone else may not work for you. It's also important to remember that self-care involves an array of components, which can include asking for assistance when needed and saying no when appropriate. Does anyone feel comfortable sharing what self-care means to them and something that they practice or would like to practice for self-care?
I would say for me as a Black woman, self-care for me is getting my hair done. Like, I just don't always feel like me unless I have like my hair done. And even when I'm doing like natural hairstyles, like
Mhm.
just doing something to it just makes me feel better.
Exactly.
For me, self-care is, going and getting that manicure and pedicure, getting a massage and reflexology. That's something that, I recently just become very adamant about. Um,
Mhm.
Getting that massage because you're taking your time, and it's been something that has been very well needed for a very long time for me. So those are two things that I do.
Perfect.
Some of the things that I do for self-care, I love to go to the museums. Um, and, sometimes I go by myself and sometimes I take my children because they love it also. And also, I know this is so strange, but I like to go to the grocery store. So, and I just walk around in the grocery store, just pushing my cart, talking to the people. But yeah, I mean, it's relaxing.
I think that's a perfect example of self-care being what works for you. Well, thank you so much for sharing those great examples. And as far as what self-care means to me, I like to think of self-care as a form of self-love and self-appreciation. So as stated before, I like to try to practice mindfulness. I love to read. I love massages as well. But next we'll talk about good self-care. It's imperative to incorporate self-care into your daily routine. And this includes setting healthy boundaries in every aspect of your life, embracing who you are, including your strengths, challenges, and vulnerabilities, being active regularly, such as walking, dancing, practicing yoga, running, hiking, or going to the grocery store, identifying what helps you relax. Some people find that listening to music, reading, and taking showers or baths are relaxing for them. And creating a manageable checklist for tasks or projects and prioritizing those tasks and breaking them down if they're overwhelming, or breaking them down to smaller tasks. Next slide. So here are some topics to think of when you're planning self-care. So some are what makes you happy, what brings you joy and peace, what makes you feel relaxed, and what makes you feel safe. Next slide. So, in planning to practice self care, you want to identify what self care means to you, why self care is important to you, Set your self-care goals. Create a routine. Be intentional. Have a self-care accountability partner. And set reminders. Next slide. So as this is the 7th day of June, I would like to charge everyone with practicing self-care daily for the next 20 days. And that may sound like a lot, but just remember that self-care can be as little as 1 to 5 minutes. And I cannot stress enough how important it is for us to do something for ourselves, especially for caregivers. So some examples of self-care include the positive affirmations that we discussed, deep breathing, walking, pleasurable activities or hobbies, watching your favorite movie, 10 minutes of yoga, paint, color, or drawing, a video chat with friends or family, playing with a pet, starting a new activity or hobby, or choosing a hobby that you have done in the past that you no longer do. Next slide. 10 minutes of meditation or less or more. Gratitude journal. Taking a nap. Listening to your favorite song. Having a mini dance party. Taking 5 minutes to decompress if you've had a stressful day, or if your loved one may be having a difficult time. Recapping on the highlights of your day. Being kind to yourself, or taking a social media break. Next slide. So this slide offers some examples of positive affirmations. And as you can see, this woman is practicing self-care. Next slide. So here are some mindfulness apps that have free versions as well as paid versions. So here are some resource tips. Connecting with your local offices of the Maryland Department of Health. Sorry, the Maryland Department of Human Services. If your loved one with a mental health condition is your child, connecting with your child's school and all of your loved one's providers, and making sure that you're asking them for resources. Connecting with local community resources such as outpatient mental health clinics, psychiatric rehabilitation programs, libraries, community and resource centers, and churches. Does anyone else have anything they'd like to add?
There's also NAMI, which is the National Alliance for Mental Health. They have those in different areas of the county. And they even have chapters on college campuses, which I think is great.
Yes,
Mhm.
those are great resources. Thank you. So earlier on, we discussed respite care. So here is some information for respite care, excuse me, which is short-term care for caregivers. And it can be for a few hours, a day, a weekend, or sometimes longer. So here are links for some additional resources. So we have the respite care, Maryland Commission on Caregiving, FAMSTA, NAMI. Next slide. And additional resources here. All right, and here are the references that I used. Next slide. So thank you everyone for joining and participating. I appreciate you all.
Thank you, Dr. Johns. That was very informative, and we really appreciate you for providing us with this great information. And of course, we have to do our 20-day challenge. So we'll keep you posted on that. I think that's a good start to ensuring that we are definitely caring for ourselves before we, provide care for others. So thank you very much.